Tell me, what are the mortality indicators? Sure, some. Mortality indicators include growth death rate, which is number of deaths divided by mid-year population into 1000. Then specific death rate, which includes age specific death rate, which is between 5 to 10 years of age. Deaths in 5 to 10 years divided by mid-year population of 5 to 10 years into 1000. And sex-specific death rate, which is deaths in females divided by mid-year population of females into 1000. And proportional mortality rate, which is case fatality rate, defined as deaths by cases into 100. And infant mortality rate is an indicator of mother and child health, which is number of deaths in infants less than 1 year of age divided by total live births into 1000. And maternal mortality rate is defined as number of maternal deaths. The maternal deaths can be due to pregnancy or related causes within 42 days of delivery. It does not include trauma, accident, or electrocution. Divided by live births into 1 lakh. Okay. What are the causes of splenomegaly? Sure, sir. The causes of splenomegaly are cirrhosis of liver, hemolytic anemia, chronic malaria, chronic kala hazar, acute viral hepatitis, and miliary tuberculosis. Okay, what do you know about intestinal obstruction? Sure, sir. Intestinal obstruction is of two types, dynamic and adynamic type. Dynamic type is where there is a physical obstruction to the flow of feces, and in adynamic type there is no physical obstruction to the flow, but the bowel peristalsis is stopped. And in both these cases, the clinical features include colicky type of abdominal pain, and it is associated with abdominal distension and vomiting, and non-passage of flatus and feces. The initial investigation which can be done is X-ray, erect or in supine position, and later on for confirmation of the location of the disease, contrast enhanced CT can be done. And after contrast enhanced CT, mainly the management include mainly the types are in dynamic type adhesions. Then it includes bowel atresia, meconium, ileus, intussusception, volvulus, and intestinal stricture, Meckel's diverticulum, superior mesenteric artery syndrome. And in adynamic bowel obstruction, it includes mesenteric ischemia, paralytic ileus, and pseudocolonic colonic pseudo obstruction. In all these cases, the initial management includes administration of IV fluid such as lingar lactate. Then nasogastric tube is inserted so that it decompresses the system. Then IV antibiotics are given to if any infection is present, and then painkillers are also there. If the patient condition improves by this conservative management, he is kept under observation for 24 hours and then discharged. And if the patient condition does not improve, then exploratory laparotomy is done, and then the bowel is seen if it is viable or not viable. If it is viable, then no problem. If it is not viable, then surgery is done. Okay. What is pasteurization? Pasteurization is a high level of disinfection of milk, sir. It consists of three types, namely vat or holder method, high temperature and short time method, and ultra high temperature. In vat or holder method, the temperature is increased to 66 degrees centigrade, and then it is holded there for 30 minutes and then cooled down. In high temperature and short time method, the temperature is increased to 72 degrees centigrade and it is cooled in a few minutes. And in cases of ultra high temperature, it is the best method adapted, and here the milk is uh, heated to a temperature of 125 degrees centigrade and then cooled in few seconds. And there are various tests for pasteurization, which include phosphatase test, standard plate or colony count test, and coliform test. Okay, what is the causes of pancreatitis, and what are the investigations done? Sure, sir. Pancreatitis is inflammation of the pancreas. It is mainly of two types, acute and chronic pancreatitis. In acute pancreatitis, the causes can include, most common cause includes gallstones, then trauma or abdominal injury, and then diabetes. And in chronic pancreatitis, it is a sequelae of acute pancreatitis. If the acute pancreatitis is recurrent in occurrence, and the patient has pain in the epigastrium, which radiates to the left side, and on bending forward, the pain is relieved, but on lying down position, the pain increases. And the investigation which can be done is serum amylase and serum lipase for pancreatitis. But serum amylase is not specific, serum lipase is specific, and the radiological investigations which can be done for diagnosis of pancreatitis is endoscopic retrograde cholangiopancreaticography. Okay, what is the national immunization schedule? Sure, sir. National immunization schedule at the time of birth: BCG vaccine, OPV 0 dose, oral polio vaccine 0 dose, and hepatitis B is given. At 6, 10 and 14 weeks, oral polio vaccine first dose, second dose and third dose, and pentavalent first, second and third dose are given respectively. At 9 months, measles vaccine first dose, vitamin A, and PCV booster, and Japanese encephalitis first dose is given. And at 16 to 24 months, measles MR vaccine second dose, DPT vaccine first booster, OPV booster dose, and Japanese encephalitis second dose is given. And at 5 to 6 years, DPT second booster dose is given, and at 10 and 16 years, TD low dose diphtheria toxin is given. Okay, what are the signs of chronic liver disease? The signs of chronic liver disease starting from the head are alopecia, temporal hollowing, loss of buccal pad of fat, jaundice, spider nevus, then gynecomastia, loss of axillary and pubic hair, palmar erythema, Dupuytren's contractures, and leukonychia nail changes, and ascites, testicular atrophy, and pitting type of pedal edema. Okay, what is Mantral score? Mantral's scoring system is mainly adopted in acute appendicitis condition, in which Mantral means migration of the pain, A is anorexia, N is nausea and vomiting. For a score of 1, 1, 1, each of these symptoms are given. T is tenderness, 2 score is given, and R is for rebound pain, and E is for elevated temperature, and L is for leukocytosis. Score of 2 is given, and S is shift of WBC to the left. Okay, what is diabetes management? Diabetes is a condition in which there is increased glucose in the blood. It is mainly of two types, namely type 1 and type 2. In type 1 there is autodestruction of the beta cells of islets of pancreas, and in type 2 the pancreas is working normally, but there is resistance at the level of the peripheral tissues. And for management and for investigations, mostly we do fasting blood glucose level, random blood sugar levels, and then FbA1c. And for management, mostly initially we give lifestyle modifications such as diet and exercise, and then we add metformin to it. And after 3 months, HbA1c levels are reassessed, and if HbA1c levels are within normal range, then they are assessed for every 6 months. If no response is there, then second line of 2 other agents along with metformin are added. If no response is there again, then insulin is added as the last resort. Okay, vitamin A. Tell me about vitamin A. Sure, sir. Vitamin A is a major nutrient which is a fat soluble vitamin responsible for the rods and cones development, which is useful for eyesight, and it is also important for epithelial regeneration. And the deficiency of vitamin A results mainly in Bitot spots and night blindness, also called as nyctalopia, and it also results in dry and scaly skin called as ichthyosis. And the major sources of vitamin A are orange and yellow colored fruits and vegetables such as papaya. Egg yolk is also a good source of vitamin A. Then mango, papaya, carrots are the richest source of vitamin A. And during for newborns, vitamin A can be given as from 6 months to 1 year, 1 lakh international units can be given, and from 1 year to up to 5 years of age, 2 lakh international units can be given 6 for every 6 months. Thank you, sir.